Hi, my name is Jessica Martin, and I'm going to be doing a presentation on the skeletal system. I do have this list of bones here that I'm going to have off to the side, but overall we're going to be going over the skeleton. There are the axial and appendicular skeletons that it can be subdivided into. The axial skeleton includes the head, the rib cage, and the vertebral column. The appendicular skeleton is mostly going to be the limbs, the arms and legs, feet, wrists, ankles, hands, all that type of stuff. So we'll take a look here at some of the bones. Starting with the axial skeleton. Here we have the frontal bone, the parietal bone up on the side here, this top aspect of the side, the occipital bone, and the temporal bone. Those make up the bones of the skull. They are considered flat bones. When we're looking at the face, we have the maxilla, which is this big face bone here. When we're looking at the nose, we have the nasal bones up here, so kind of this top portion of the nose. Inside the bottom of the septum is called the vomer. And then on the lateral aspect of the inner nose, we have bones called the inferior nasal conchae. Those bones are not really visible on this model at all, however they do exist in real life. In the orbit, there is a little bone here that is called the lacrimal bone. The lacrimal bone just sits in there, again really hard to see on this model. Then we have the zygomatic, which is the cheekbone, and here is the mandible, or the jawbone. All of these bones are kind of irregularly shaped. They all kind of do their own thing, so they are called irregular bones. They don't really have other bones that look like them. So then moving on here, we do have a few more facial bones. So we can see them from this angle here. So right here, this where there's kind of a little indent is called the sphenoid bone. That little indent is actually what holds the pituitary gland. And then up forward, you can see that even less. There are some little holes there. The little holes are the cribriform plate of the ethmoid bone. So those bones are both also considered irregular bones. We just can't see them from the outside. The ethmoid bone is actually also considered a pneumatized bone, meaning little holes, which is what I was referencing when I was trying to point it out on the video. So moving on with that, we will take a look at the vertebral column. So this top portion here is the cervical vertebrae. Then we have the thoracic vertebrae that are articulating with the ribs, and the lumbar vertebrae in the low back region, followed by the sacrum and the coccyx. Again, these are all irregular bones. They don't really have anything else that looks like them. They're just doing their own thing. So they are called irregular bones. And then to finish this up, here we have the sternum, and then all of the ribs of the rib cage are the last components of the axial skeleton that we have to go over. Those are considered flat bones. So now we will take a look at the appendicular skeleton, the arms and legs. We will go ahead and start up here with the pectoral girdle, which is another name for the shoulder joint. Here we have a clavicle. So that's what connects the axial skeleton to the appendicular skeleton. Then we have the humerus. This is the radius on the thumb side and the ulna on the pinky side. And then I'm going to put him down for a second so we can take a closer look at the carpals. So the carpals are these bones here in the wrist at the base of the hand. So when we take a look at these going across, we have the scaphoid, the lunate, and then the triquetrum. On top of the triquetrum is a little bone called the pisiform bone. Then going back around to the other side, we have the trapezium, then the trapezoid, then the capitate, and then the hamate. Then here we have a row of metacarpals, followed by phalanges, and that would make up the hand and the wrist. So all of the bones here are considered long bones, except for the little bones here, the carpals. Those are called short bones because they're just little and boxy. And then we will go ahead and finish up with the appendicular skeleton, looking at the hip joint or the pelvic region here. So we have two hip bones on either side that connect again the axial to the appendicular. This is a femur. The patella, or the little knee bone, is here on the femur. This big bone in the middle is the tibia, and the lateral bone is the fibula. And then again, we have little bones here. This time they're making up the ankle. But the boxy bone on the end right there is the calcaneus. This bone right here is the talus. And then when we look at these here, anterior to the talus, this one right here is the navicular. On the side is the cuboid. And then we have the 3 cuneiform bones here. We have a medial, a lateral, and an intermediate. Again, similarly to the wrist, we have metatarsals, and then followed by phalanges. So when we're looking at the classification of these bones, we have the hip, which would be an irregular bone. Again, it just doesn't kind of fit in anywhere else. The patella would be a sesamoid bone, meaning that it's usually suspended within a ligament right now, or a tendon, sorry. Right now we don't have the tendon here, but it is not normally just sitting on top of the femur like this. It normally is within a tendon. And then, again, like the carpals, the tarsals are short bones. But everything else, these bones of the legs are long bones. So, knowing the normal anatomical, or what a normal skeleton looks like, is super important. For my future career, I want to be a physician assistant, and so knowing what this is supposed to look like, in terms of proportions and relations, is super important. Because if a patient came in with really thick bones, I might be able to look at them and run tests or diagnose for acromegaly, which is basically when bones get too thick. Similarly, but differently, if a patient came in with bones that were really too short, or if they had stopped growing too early, I might be able to look into potential issues with growth hormone, or something like achondroplasia, where their bones have fused too fast. They've stopped growing too fast, so that they haven't gotten to fully develop. So keeping things like that in mind and knowing what the skeleton is supposed to look like versus what it might look like in the field or on a patient will be very important to keep in mind. Thanks.